Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. Now I'm going to talk about dizziness in pregnancy. Very common symptom to have, and it can be pretty disconcerting. Here's a few measures that can help with the normal customary causes of dizziness in pregnancy, but you should know that if these maneuvers don't help, you should certainly mention it to your healthcare team, and this assumes you're of normal health and don't have an underlying heart condition or other health issue that contributes to it. So once you get pregnant, very early on, you have morning sickness, and the hormones can make you feel nauseated, and when you're nauseated you don't necessarily eat as much, but you've got this little baby growing inside and it's taking the sugar away from you, so you can get low blood sugar, you can get hypoglycemic. So when you get hypoglycemic, low blood sugar, that can make you dizzy. Another thing that can happen is your baby's also taking fluids from you and your veins are starting to dilate, so the amount of blood in your body increases, and that means you're more likely to get lower blood pressure. So you need to drink more fluids. So if you're dehydrated, if you haven't had enough fluids, then you can also get dizzy as well, or your heart can race. The two can work together, okay? So, and as you get further along in pregnancy, the hormones that make you nauseous go away, you start feeling better, but your baby is growing, it's taking more fluids from you, it's taking more sugar from you, and it's also more work for your heart and lungs to support not just you and the baby, and that can again lead to dizziness if your blood pressure is low, if your sugar level is low, and it's a little higher chance if you're a smoker, if you're overweight, if you're running around like a chicken with your head cut off. So if you have a job and you got 2 other kids, then that also can contribute. So what do you do when you have these symptoms? Well, sometimes when you're not pregnant, you just power through. But when you are pregnant, if you don't pay attention to those symptoms, you can pass out. So you do need to pay attention to them. You have to think, okay, when's the last time I went to the bathroom? If you haven't peed in a while, then you probably haven't been drinking too much because you're too busy doing things. And then that means you're a little low in fluids. Drink some fluids. The further along you get, especially if you live in a hot environment, you should have fluids with you. If you're sweating, you should have some Gatorade. Be careful, or Powerade or sport drink to replace the sweat. Be careful if you have diabetes in pregnancy. You don't want too many sugary drinks as well. You also have to remember that usually when you're about to eat is when it's time to eat and you're hungry and your blood sugar is dropping. And that's a common time to get dizzy, right when you eat. And so I hear a lot, well, I did eat and I still felt dizzy. The reason is that you don't actually get the sugar from the food right away when you eat it. It's why they tell you not to go swimming right after you eat, okay? So right after you eat, your body is dedicating resources to help you, the fluid, the blood flow to your intestines and your stomach to help digest and to help absorb the nutrients from the food, but you don't get them right away. So if you go jump in the pool, you're more likely to get a leg cramp, okay? So when you're pregnant, when you're hungriest and you eat some of those foods, you don't get the nutrients right away, and then now your blood flow is diverted to get the food, and that can make you dizzy. How can you fix that? Well, it's your food choices, okay? So solid foods are harder to digest than liquids, and fats are the most difficult. So if you eat a Whopper and fries, you're gonna feel dizzy, you get nauseous later on and maybe throw up. If you eat too much, and you won't get glucose right away. On the other hand, if you have some fruit, that'll get it to you quickly. If you have some fruit juice, that'll get it even faster, but we encourage for a balanced diet to eat more fruit and less fruit juices. But if you're feeling dizzy, some Gatorade, some fruit juice, even a soft drinks with a little sugar will get you that sugar faster than eating like a spoonful of peanut butter. That won't get it to you as fast, okay? So I hope you found this helpful, and And there's another video that I have about laying on your back and how that can cause dizziness too, from something called IVC compression syndrome. So there are other causes. But hopefully you found this helpful for you. And again, if the problem persists and these interventions don't help, mention it to your healthcare provider. Thank you.